third installment of the health and wellness series. Today we will be focusing on weight management and diabetes with our good trusted colleague James Lucas III, registered dietitian. For those who are new to this program, I'm going to tell you a little bit about James. James has over 10 years experience as a registered dietitian, certified specialist in sports dietetics, exercise physiologist, and he is the owner of Jlucas Nutrition, which offers comprehensive and realistic meal plans, nutrition advice to help optimize your health, wellness, and athletic performance. Just like myself, James is a graduate of University of Connecticut, has a bachelor's in nutrition sciences and a minor in nutrition for sport and exercise. James also worked several years as Yale Cancer Hospital as an oncology dietitian, working with cancer patients, athletics, and also focuses on individual nutritional needs. James, like he was telling Erica, currently resides in the Fort Worth, Dallas, Texas area, and you can find him at Jlucas Nutrition on YouTube, Instagram, and his website, www.jlucasnutrition. As we spoke about earlier, he has a book out right now. It's called Hip Hop Nutrition Volume 1. I suggest that you all check that out. If not, we can get you a copy at some point before the seminar is over. And there's a few people that I would like to thank today. I would like to thank Ballheads Incorporated out of Meriden, Connecticut for being the fiduciary and fiscal sponsor for these programs. I would like to thank the Born Rich Foundation, obviously, Meriden Children First. I would like to thank our friends at Equity CT and Connecticut School and State Finance Project. I'd like to thank our friends at My Executive Room, our friends at Mothers Demand Action, and our friends at the UCONN School of Agricultural PEP program. So James, without further ado, I will let you get started. And if anybody has any questions, please leave them in the chat, and I'll be facilitating some discussion in the chat as well.
Awesome. Thank you, Rich, and good morning to everyone. Thank you for joining this discussion this Saturday morning. Hopefully I'll give you a few gems in relation to weight management and diabetes. This subject is pretty robust, and we know that a lot of individuals may be at risk for diabetes, may have diabetes, and we're all, struggling to maintain our weight and keep the COVID-15 off, if you know what I mean. So let's get into it. So in relation to what we'll talk about today, I'm going to go over diabetes, its prevalence in society. I'll talk about type 1 diabetes, type 2 diabetes, and type 3. That's not an error. Type 3 diabetes as well. It's a new concept that I just learned about last year when I was at FNC, which is a food and nutrition conference. Additionally, we'll talk about nutrition for diabetes management and prevention. We'll get into weight management for controlling diabetes, and we'll be speaking about weight management from an exercise and diet perspective. And then I'll get into supplements, diabetes, and weight manage a bit, and we'll get into a Q&A. So when we're talking about diabetes, we recognize that it currently affects over 20 million people just in the United States and around 500 million people worldwide. That's a lot of individuals. And the thing about it is, I don't know if you guys can see my full screen. I was told that it was too large. Oh, let me see here. Hold on. Let me try. Let me see if I do it this way. Is that better?
I was seeing it before, like the full diabetes slide. Now I see your presenter view with next.
Oh, the presenter view. Okay, hang on. Don't worry. We'll get this fixed. So let's see here. Share. I don't know why it's doing it so large.
James, it was at least on my screen. It was fine. That's totally fine.
It's fine. Okay. Yeah. What's important is the message. So we'll just keep rocking with it. So yeah, generally, when we're talking about diabetes, we know that by the year 2040, there may be between 521 to 829 million people that may be living with diabetes. And then according to the CDC and the American Diabetes Association, diabetes ranks among the top 10 causes of death, which is likely an underestimation as diabetes is known to cause other secondary conditions like heart disease, chronic kidney disease, and Alzheimer's disease, which is actually where the type 3 component comes into play. It's actually where diabetes affects the brain versus affecting the body. So there's some connection there where when we have that diabetes condition present, it might be more of an effect on the brain versus the other parts of the body, like the heart, the kidneys, and the eye. What's really important about type 2 diabetes, or diabetes in general, type 2 more so, as it's known as adult onset diabetes, is more difficult to recognize how it may affect your body from a more acute or even a chronic perspective. Usually when someone develops diabetes, they get those acute symptoms, dehydration, excessive urination, fatigue, and hyperglycemia, and then they end up in the hospital, they get checked, they find they have diabetes, and then they start taking medication and you feel fine. You might have some days where you have hyperglycemia and you're a little off, but all you got to do is take some metformin, some insulin, cut back on your carbs, and you feel okay. So you're like, this condition doesn't really seem like much, but it's not the primary condition that gets you, it's the secondary pieces, which is where the heart disease, chronic kidney disease, retinopathy, or damage to the eye tissue comes into play. It's because with diabetes, the red blood cells have sugar stuck to it. And that sugar has jagged edges that are circulating around the body, causing damage to our organs. That's really where type 2 diabetes, or diabetes in general, can be an issue. So generally, we know that right now, type 2 diabetes has become the most common form of diabetes in both adults and children. And I'll probably be focusing most on this condition, and I will address some components of type 1. But before we get into better blood sugar management, I just wanted to run a quick video by you to give you a visual from the National Institutes of Health as far as diabetes and its condition.
Diabetes is a disease that occurs when the amount of glucose or blood sugar gets too high. This is glucose, the main source of our body's energy, which comes mostly from the food we eat. Normally, insulin, a hormone made by the pancreas, helps glucose from our food get into our cells to be used for energy. But what happens if we can't produce enough insulin, or we produce none at all? Let's take a look at the pancreas, where insulin is made. With type 1 diabetes, our body's immune system destroys the cells in our pancreas. This means our body can no longer make insulin, and we need to take it daily to live. In type 2 diabetes, either our body...
Well, I'm not sure why that changed, but generally I can explain a little bit more to you. Type 1 diabetes is basically where a person's pancreas isn't making insulin, right? So the person needs to take insulin in order to help manage their blood sugars. Now, in that regard, it may develop, say, type 1 diabetes early on in life. It may be related to a genetic condition where the pancreas, the beta cells don't make insulin. So you've been taking insulin for a long period of time. For these individuals, the challenge comes into play in regards to the risk for hypoglycemia, or low blood sugars. So eating the right foods throughout the day and correlating it with the insulin is very important, because you can get a dose of insulin, and then if you're not eating anything, that insulin will digest and break down the sugars in your bloodstream, and then you'll feel very low. It actually can cause a coma if you are, taking too much insulin and not eating properly. So it's very important to have blood sugar management through the diet and have specific foods that I'll talk about later in the presentation. Now, for type 2 diabetes, which is adult onset diabetes, this is a different condition. In this circumstance, the pancreas may be making enough insulin, but what happens is your cells, such as your muscle tissue, which is the primary place where your body digests carbs, the muscle tissue is not responding to the insulin. So therefore, the sugars that are in your bloodstream, they never have an opportunity to get into the muscle tissue. Therefore, you have high blood sugars running through your bloodstream. They never get a chance to get into the cell. The reason why can be multifactorial, but one of the issues is that there could be fat circulating around the muscle tissue, so the insulin can't reach the surface of the muscle so that the cell then opens up. Now the sugars can get into the cell. So with type 2 diabetes, it's usually a condition of the cell not responding to insulin. And then you have to take medications like metformin, for example, where the body is suppressing glucose release from the liver and increasing the sensitivity of glucose at the muscle tissue. What's great about type 2 diabetes is you can actually reverse the condition. There's a chance you can reverse it. There's a higher probability versus type 1. You can't really do much about it due to the genetic predisposition. By utilizing weight management principles, working out more, that naturally increases your insulin sensitivity. It can help improve blood sugars over time. So if anyone has any specific questions about type 1 or type 2, please feel free to mention in the chat. So now we'll move forward in relation to nutrition therapy for diabetes and pre-diabetes. There was a recent publication that came out 2019 in Diabetes Care. This is the most updated research in regards to tips and suggestions for managing diabetes. I know that it can be very challenging and there's no one diet that would fit, but I thought I would share some of these tips that they've suggested from this report. So reducing overall carbohydrate intake has demonstrated the most effective intervention for improving glycemia. So you want to be able to identify the carbohydrate foods in your diet and reduce those food sources, replace them with non-starchy vegetables and lean proteins. If you're having a difficult time recognizing what foods are carbohydrates, I have a free meal guide that you can download, which I'll provide the link for you, where you'll be able to get a hold of your carbohydrate intake. We know carbohydrates are excessively abundant in the diet. And the reason why they're identifying carbohydrate as a way to manage blood sugars is because with carbohydrate ingestion, it actually stimulates the production of glucose, which is the main factor that we're looking to manage from a diabetes perspective, the sugars that are coming into the body. So as we're eating breads, rice, pasta, cookies, cakes, orange juice, fruits, those types of foods, they're being broken down no matter what the source is into glucose. And when we have that increase in glucose, that can affect our blood sugars in either a good or a bad way. But overall, that is one suggestion they've mentioned. So we want to have a low carbohydrate diet. Also, weight loss is recommended, at least a 5% weight loss to receive a clinical benefit. Again, with weight loss, that's reducing the fat content. Now the body, when it's ingesting glucose, the muscle tissue can see the fat and then digest it into the muscle tissue so that you're controlling your blood sugars over time. Additionally, for those who are at risk for pre-diabetes, it's suggested to try and aim for a 7 to 10% weight loss. We want to replace any sugar-sweetened beverages with water as often as possible, of course. And you could also use sugar substitutes. However, we don't want to use sugar substitutes and think that it can cover us for an unhealthy diet or making unhealthy choices. Like my man Kanye West said, how you going to order all that food in a Diet Coke? He said it, not me. So now it also mentions drink alcohol if you consume alcohol, sorry for the typo, in moderation, 1 drink or less per day for adult women and 2 drinks or less for men. Watch, however, for hypoglycemia, because when you drink alcohol, it actually suppresses your blood sugars. And for any of the athletes out there, drinking alcohol can affect your ability to replenish carbohydrate or that energy in your muscle tissue. So during the season, probably don't want to drink much, and you definitely don't want to have an alcohol beverage after a football practice or whatever. But it can definitely have an influence on your ability to store blood sugars in the muscle. And this guideline also mentioned if you're taking metformin, you want to look at your B12 levels, as metformin has been indicated to have an influence on that particular vitamin. For anyone with type 1 diabetes, they recommend doing carbohydrate counting. I'm sure you have heard of that, where there's a carbohydrate number per food source. For example, for every 1 point, it's equal to 15 grams of carbohydrate. You probably want to keep yourself to about 2 servings of carbohydrate per meal, depending on your body weight and your blood sugar control over time. Replace any foods high in carbohydrate with foods low in carbohydrate. It has been shown to improve blood sugars, triglycerides, and HDL, good cholesterol. Choosing a diet that's low in saturated fat has also been shown to improve LDL, the bad cholesterol levels. It's recommended to reduce your intake of sodium. Less than 2,300 milligrams of sodium per day is suggested. And it's also suggested to consume 2 servings of fatty fish like salmon 2 times per week. I had some delicious salmon last night, blackened salmon. So now, generally, when looking at different diets, we see that there was an analysis to make an assessment for different diets that we have at our disposal. We know that there's a lot of information coming at us, and it can be challenging to figure out what's right. Again, there's no one diet that is fitting for controlling diabetes. It should be individualized based on your preferences and so forth. So here they recognize, just based on the US dietary guidelines, eating a diet with a variety of vegetables, fruits, whole grains may provide some general balance in your diet. I'm more favorable for this Mediterranean style diet, which I actually do have meal plans that you can follow that are Mediterranean based, where you're getting plant-based foods, vegetables, beans, nuts, seeds, fruits, whole intact grains. And this diet has been affiliated with reducing the risk for diabetes. It has been shown to reduce A1C, which is the marker that gives an indication for your blood sugar control over a longer time. It helps with lowering triglycerides and reducing the risk of major cardiovascular events. Mediterranean diet has been coined the best diet in the world. So adapting these principles and adding these foods into your diet is generally helpful. Vegetarian or vegan diet also has been shown to reduce the risk for diabetes, reduce A1C, and support a weight loss effort, as well as reduce those cardiovascular markers like LDL and increasing HDL. A low-fat diet was affiliated with reducing the risk for diabetes and supporting weight loss. And there are some other diets as well. We know low carbohydrate, like a ketogenic-like diet. You got to use some caution in that regard in relation to ketones, as those are fatty molecules that increase because the body doesn't have enough carbohydrate. So it starts to produce fat, which the body then uses as a fuel source. But at times, those ketones can become toxic. So you have to use caution. And of course, always check with your doctor when following any specific diet. So generally, we see that low carb diet can help with A1C reduction, weight loss, lowers blood sugar, and essentially it eliminates your food options, right? So you're gonna naturally eat less from that perspective. And then the paleo diet, they show mixed results, inconclusive from that perspective. So now, in moving into a little more data, we see first place, there was analysis suggesting out of the European Journal of Epidemiology that the low carbohydrate diet and the Mediterranean diet were #1 best for managing glycemic control. Again, I have a very specific Mediterranean diet you can find on my website, and I could always help you individually to see what diet might be best for you and make little subtle changes in your intake. So now in regard to controlling diabetes, it really comes down to these principles here. We want to use diet and exercise to help with managing the absorption of glucose. So by having a diet that's very rich in fiber, as an example, that's going to help blunt the increase in blood sugars in the absorption of carbohydrates from your gut. We want to also reduce oxidative stress, which comes from that high hemoglobin A1C level. When you have more oxidative stress, more inflammation, that's causing more damage to your cardiovascular system, your your kidneys, and your brain health. So you can reduce oxidative stress by providing antioxidants, which can come from blueberries, and other foods that we discussed on our immunity call last week. Additionally, we want to improve insulin sensitivity, right? So by exercising, that's increasing the sensitivity of the muscle tissue to the insulin that's ingested. And then that will help to increase the glucose uptake by the muscle tissue. So these are the principles, and this is pretty much what we're aiming for when managing diabetes. Now, in relation to some of the methods to measure blood sugars and the specific value that gives an indication for potential diabetes, you have your random plasma blood glucose tests that may be ordered. This is a blood sugar assessment that you may have at the doctor, say when fasting for an 8-hour period, or I'm sorry, at any one time, say 1 to 2 hours after a meal, you randomly check your blood sugars. And if it's over 200, that means that something isn't right. So that is an indication that there could be some mismanagement in blood sugars. There's your fasting plasma glucose. This is the one that you have checked at the doctors, where they're saying that you can't eat anything for 8 hours before the test. You want this level to be below 100, but if it's between 100 to 125, again, this means that those blood sugars, unfortunately, they didn't make their way into the muscle tissue, and there's something giving an indication that you're at risk for developing diabetes. And then last, if you have multiple fasting blood sugars assessed, where your blood sugar is over 126 milligram per deciliter, that means that you likely have diabetes. And there will be other tests the doctor will do to confirm that. And then we have what's known as an oral glucose tolerance test. This is where you have a drink that has about 50 grams of glucose that you consume, where your body is kind of like a tolerance to glucose, and they measure your blood sugars to see where you are. If you're below 140 after a period of time, it gives a normalcy. But if you're over 140, there's a chance you have prediabetes. Over 200, there may be a chance you have diabetes. And then, of course, from a chronic perspective, this is the most important factor. You want to generally look at your hemoglobin A1C level. We talked about glycosylated end products last session, which is a marker that can be found with like fried foods and other cooking methods, and that can have an influence on your hemoglobin A1C. Your hemoglobin A1C should be low. Again, this is an indication for those jagged edges that are circulating around your bloodstream, and it should be below 5.7%. All right. So now we'll transition over into weight management. I'll check the chat box to see if there was anything that came up that I can address quick. I see that Carrie, she mentioned that she loved that I included type 1 diabetes or hypoglycemia, which is rarely talked about it. Her mom struggles with that. So if there's any other questions in that regard, we can discuss it, and we'll keep it rolling. So weight management. Weight management starts with how many calories your body needs every day to maintain your current weight. There's a lot of different, say, applications out there that you can use that can help calculate your calorie needs. It will ask for your age, your height, your weight, and your gender. Also, it will include a factor to include activity, as these are all components that can influence your energy needs, which plays into weight management over time. a lot of folks may be looking for weight loss, but we could also throw in weight gain. I'd like to know in the chat, are you looking to maintain your body weight? Are you looking to gain weight or like muscle? Or are you looking for weight loss? I'm gonna put in here, I'm gonna put my response as well. All right, a few people put some responses in, so I know what to focus most on. So I got a gain, we got a loss, we have some weight loss. So I'll give you some tips that'll focus more on weight loss. For myself personally, I'm trying to stay lean, get to my fighting weight, if you will. It's always important to, be comfortable where you are, and it could be a difficult component to get to your weight goals. It's very, very challenging. So to lose weight, we know that we need to create a calorie deficit, meaning eat less or exercise more. Attempting to lose weight quickly, a lot of times we sometimes look for these quick fix. Say we're going on vacation, we got 1 week, let me try this lemon water diet. Well, it might work temporarily. You might see some fair results, but it's actually not a very healthy thing to do. It could actually offset your metabolism permanently. So say your body needs a certain amount of calories, et cetera, but when you shock the body that way, it could actually throw off your homeostasis and cause your metabolism to decline or slow down from a permanent perspective. And remember, when you're looking for weight loss, you actually want to try to increase your metabolism, right? The furnace is burning hot, right? So that now when you consume the fuel, it burns it up quickly so it doesn't remain set on yourself. Now, there's something also known as the set point theory, which basically is your body's internal weight control mechanism. And it very tightly regulates body weight. It doesn't really like to move in the direction of weight loss or potentially weight gain. So it really comes down to putting in that effort to modify the diet and put in exercise so that you actually change that set point, which takes time for that to occur. It's really around behavioral modification. That's the biggest factor. Psychologically, just thinking about your goal, writing it down, keeping the right foods around the house, and keeping your goal in mind so that when you're wanting to go for that cookie, that cake, think about, I'm trying to lose weight. Let me skip this. Let me choose a fruit, or let me eat a salad during lunch. That's really what it comes down to. And then getting moving as well with exercise. So essentially, when we look at these components here, we want to make sure that we are balancing calories in, calories out, right? That's the factor for weight gain, maintenance, or loss. And then we have what's known as our metabolic rate, where we have calorie needs to support what's known as basal metabolic rate, which is the amount of calories that we need for living. So say when we're sleeping, at rest, breathing, the metabolic functions that occur through what's known as our sympathetic nervous system, we need calories to support that component. And when I'm calculating your calories, I'm going to look at your basal metabolic rate. So say if you need 1,200 calories just to maintain life functions, we'll then include your activity level and also your diet-induced thermogenesis, which is 10% of your calorie needs, to come up with a calorie estimate. Then once we do that, we would make adjustments, either more calories for weight gain or less calories for a weight loss, to calculate your needs. And then essentially, we want to aim for a nutritional and exercise regimen that will help to induce more muscle gain, because as we know, the muscle is more packed. It helps with body appearance, body composition, versus fat, which is more dense. So when you're losing weight, you don't always want to focus on the scale, because the scale may not really reflect the healthy diet and exercise regimen that you have induced. And you might actually see that the scale is going up, especially if you're working out with weights and, eating a higher protein diet. So don't get discouraged because you may be increasing your muscle, which weighs more. It's more metabolically active and will burn more calories over time. You really shouldn't look at your weight change until about a 4-week period. But you can check your weight on a weekly basis to see where you are. How many here in the chat fall into the accustomed regimen of weighing yourself every day when you're on a diet? I'm just curious. We have some folks that raised their hand there. Yeah, generally, I try to recommend in regards to weighing yourself, you want to weigh yourself, say, at the same time every day, or not every day. If you're going to do it every day, weigh yourself at the same time in the morning, for example. You can keep a log and make sure you void prior to weighing yourself. And try to do it on a weekly basis, like say a Sunday morning or a Monday morning on weekly. That will be a better reflection of where you stand because your fluid status can change on a day-to-day basis. So generally we see week 1 of a weight loss calorie deficit effort demonstrates that 70% of the weight loss is actually water and only 25% fat and about 5% protein. No matter what, you're always going to break down some protein in a weight loss effort. Then by week 2 or 3, we notice that fat is now 70% of weight loss versus only 25%. So now at week 2 or 3 of your weight change is giving a better reflection of your actual body composition loss. That's the thing. When you're losing weight, it's hard to know, am I losing fat, water, or protein? We want to lose fat, of course. And then in the 4th week, this is really where you're starting to roll. You're no longer losing water as weight loss, but you're primarily burning fat. And after the 4-week period, 85% of the weight loss is from fat tissue. Additionally, you'll lose some protein as you recognize, which is why increasing your protein during a weight loss effort is essential and very critical. Muscle preservation is important, especially when we're talking about aging. We don't want to lose muscle. We do naturally lose our muscle with time. For example, by the age of 40, we lose about 7% of our muscle per decade, right? But then by the age of 70, there's an acceleration in the loss of muscle where we have a 15% loss of muscle per decade. So you can counteract and slow down the muscle loss by increasing your protein. So in our original presentation on health and wellness, I mentioned that you should be aiming for at least 30 grams of protein per meal. I would even go up to 40 grams of protein per meal. And again, if you don't know what foods have protein in, my meal guide will give you all protein foods, whether from plant or animal based. We'll talk about why the protein food has such a critical role in supporting your weight loss effort momentarily. But in relation to this slide, the protein is important to preserve muscle because look, week 4, you're losing 15% of your muscle per week. 15% of your weight loss is coming from your protein source. So you want it to come from your diet, not from your muscle tissue. All right, so we'll get into exercise and diet. There was a question, making the right choices when you are hungry is hard. Do you have any tips on how you can manage your hunger and cravings? Well, this slide here actually will give some tips in that regard. First, what we want to recognize and what we often ask ourselves is what's better, dieting or exercising? Well, there's research showing that diet is around 3 times more effective for supporting a weight loss effort compared to exercise changes alone. I should ask you all, what do you use or what do you find to be easier to do when aiming for weight loss effort? Would you say exercise more or eat less food? Do you use diet, exercise, or both? We have diet. Anyone else? Both. Both, absolutely. Ideally, using both of these regimens would help in a weight loss effort, but it can be tricky in regards to diet because we eat every day, right? We have breakfast, lunch, and dinner, But when you think about exercise, we might exercise once a day for maybe 30 to 60 minutes, but sometimes we all get lazy and have our days. Again, that's where that behavioral change comes into play, so that you're keeping consistent with your exercise regimen. Now, from a diet perspective, it's all about managing the macronutrients, right? So your fat intake. Fat can contribute to 9 calories per gram, and it only has a 0 to 3% effect on your metabolism. When we're talking about that slide previously on thermogenesis, we know that when you eat food, it actually contributes to 10% of your metabolic need, or it burns 10% of your total calories, right? When you're eating a diet that's primarily fat, it doesn't have a big influence on your metabolism. So you don't want to eat a diet that's primarily focused on fat, which is why personally I'm not a big fan of ketogenic for long-term weight management. Now, carbohydrates, they provide 4 calories per gram, and it has a metabolic effect of up to 5 to 10%. But with the carbohydrate foods, we want to choose more high fiber, low glycemic carbohydrate choices that will break down more slow, which will keep you more full throughout the day. Additionally, protein is going to be, again, the most important factor. When we're looking at protein in relation to carbohydrate, we see that it has 4 calories per gram, the same amount as carbohydrate. However, when we're looking at the metabolic effect of protein, it is up to 20 to 30% of your metabolic need, or supports the metabolic effect by 20 to 30%. So that means when you consume a protein food, your body's working to break that food source down, right? Versus the carbs and fat, which is like the body just digested and it doesn't make you feel full. So when we're talking about what foods to consume in order to reduce cravings and to support your appetite, you want to focus on protein. So breakfast, lunch, dinner, snacks, they all should have enough protein in it. At least 30 grams during dinner and at least a 10-gram protein snack between meals. And generally speaking, we often think about when should we eat, how much should we eat. There's no evidence to support that eating more often will increase your metabolism. I know in the past people were like, hey, eat 6 meals a day. There's no evidence to support that will increase your metabolism per se, but it could be individualized as far as what will work best for you. Eating once a day, I wouldn't really suggest that. 3 times a day, perhaps twice a day. It's all variable. Now, exercise and weight management, when we talk about calorie burn from exercise, from a post-exercise perspective, we have something called EPOC, which is post-exercise oxygen consumption, right? This has to do with like your glow. You know how they say the afterglow when you're working out, it's like, man, I'm still burning calories. Well, it doesn't really contribute to much of your energy expenditure after your workout. You might burn up to like another 75 calories for an 80-minute exercise regimen. I don't know how many people are exercising for 80 minutes. What's your typical workout routine, or how long do you usually work out? Do you find yourself doing a 10-minute HIIT, 30-minute cardio, 60-minute gym exercise regimen, or do you find yourself doing more of like a, marathon run for a longer period of time? Just curious. So we have some folks that are doing yoga, 10, 30 minutes. I know that for myself, I'm either doing a 30-minute jog, or I'm doing, right now, the gym's not open, so I'll do like some free weights and pull-ups for like 30 minutes, really. That's it for me. Some people do some free weights, walking, absolutely. So when we're talking about all these different exercise regimens, we have aerobic exercise. This here is your cardiovascular conditioning exercises, like jogging, for example, is good for the heart, can help to support weight loss. And during the aerobic exercise, you're not burning as many calories depending on the effort. The more high intensity, the greater the calorie burn during that exercise versus if you're doing a lower intensity. But this generally can help support cardiovascular health. Anaerobic activities, meaning without oxygen, are those activities like your weight training, your lifting. This is a super effective exercise regimen. You want to use both aerobic and anaerobic activities, push-ups, body weight squats, pull-ups, bicep curls, shoulder press, things of that nature. That is very helpful in relation to controlling blood sugars, because remember, 90% of the sugars that you eat digest in the muscle. So if you do aerobic activities, that means that you're increasing the muscle size and you're maintaining the muscle. So now you have more storage tanks, you know what I mean? You got more storage tanks so that now when you consume blood sugar, or I'm sorry, carbohydrates, the body has a big storage reservoir. So you want to make sure you're including these aerobic activities, and note that they burn more calories per minute. You're burning around 9 calories per minute in relation to these aerobic activities, and they may have a greater effect on that post-exercise metabolism. And then you also have, I mentioned this concept last week or so, your NEAT activities, which is your non-exercise activity thermogenesis. This is like your subconscious activity, your fidgeting, chewing, walking, even sitting up in a chair, maintaining posture. They found that even standing at your desk can burn an extra 200 calories versus sitting. So those little factors that are contributing to a total calorie deficit per day. All right, so now we'll get into looking at diet versus exercise. So here we have some common, say, food sources and how many calories it contributes to your diet. And then I'd like you to tell me how many minutes of walking or running you'd have to implement in order to burn these calories. So we'll start with the first one. Get your chat box ready. For a sugary soft drink at 138 calories a serving, how long would you have to walk or run for? I'm gonna say about 30 minutes. About 30 minutes. Someone said jogging or free weights for 30 minutes. Or walk for an hour. Certainly, let's see what we have here. So we need to walk for 30 minutes or 26 minutes, or you could run for 13 minutes. Which one would you rather do? You know, slow run at 13 minutes, get it out the way, or to go for a 26-minute walk. It all depends on your preference. Now, chocolate bar, 229 minutes, or calories, I'm sorry. How much walking or running would you have to do to burn a chocolate bar? 45 minutes of walking. Any takers? About 45 minutes, definitely, of walking, or 22 minutes of running. How about a 445 calorie sandwich? How many calories do you need to burn, or how much do you have to walk to burn these calories? An hour and 22 minutes. I don't know about you, but I'm not walking for an hour and 22 minutes. Or I don't even want to run for 42 minutes. 30 minutes is my cap. What about a large pizza? Just a quarter of it, right? That's about 449 calories. We got to walk for an hour and 23 minutes again. It's very similar to the sandwich. Or run for 43 minutes. And then for coffee, just drinking a mocha that has sugar in it, etc. That's about an hour of walking. So again, if we can manage the diet, I think that might be easier than having to go out for a walk, you know, especially if the weather's not fitting. So we want to use more management. We might find ourselves trying to burn the calories off like my man right here. We're going crazy on the treadmill. And this is not something that's sustainable to you know, try to run real crazy. I know I won't be able to do these sprints for a full lifetime. I'd rather use diet to manage weight loss. We might try to, you know, run fast, and, you know, there's more of a chance we might injure ourselves like my man here. We just want to take it slow and steady. You know, just walk, be cool, get some physical activity in, and don't worry too much about making it complicated. So in relation to supplements, we'll switch over to supplements for diabetes and weight control. And this here can be tricky. I would recommend definitely don't take any of these unless you check with your doctor, because there are some potential medication, complications or interactions. That's what I'm looking for, food nutrient interactions. But I just did like a quick review, read over some quick studies to see what supplements have been indicated to help support diabetes and or weight control. One of the number one suggestions that they mentioned was fiber. So you can get fiber obviously from your diet. You want to aim for 30 grams of fiber per day minimum. And again, the reason why the fiber is very influential is because it's going to help control blood sugars. I know that someone was asking about type 1 diabetes and hypoglycemia. The way that you might be able to manage a crash in your blood sugar is by consuming a food source from carbohydrate that has fiber in it as well, because what's going to happen is now you'll get a slow, steady rise in your blood sugars, right? Versus say when you just have canned peaches or say applesauce or orange juice, your blood sugars are going to go real fast and then they're going to crash. So you want to have foods that have, say, mashed potatoes with broccoli and protein. It's the glycemic load. All those foods combined, the broccoli particularly that has the fiber that can help control the blood sugars. Or say if you're about to work out, you want to have a food source that has fiber in it, fat, protein, like say a protein shake with peanut butter and oatmeal and a little dash of cinnamon, you know what I'm saying, after your workout or beforehand, maybe an hour or so. And you'll have to play with it based upon your metabolism and your digestion. But fiber is important to controlling blood sugar. There was something else that was called inositol. For those who have type 2 diabetes and pre-diabetes only, it was recommended. And there was some indications that it could be helpful for polycystic ovarian syndrome. So that might be something to look at and speak with your doctor about. Berberine was another supplement that had good evidence behind it, but it might not be recommended for someone with type 1 diabetes because of hypoglycemia. A small dose of magnesium was also potentially considered to help with blood sugar management. Also, potentially a low dose of zinc. I wouldn't supplement with these too much, maybe, every other day, consider a zinc supplement, but you have to use a lot of caution with these nutrients because they could throw off your metabolism if you're taking too much and throw off your blood sugar control. Secondarily, chromium was mentioned as an intervention, but again, have to use caution. Some of the diabetic supplements have chromium in it, and it helps with increasing blood sugars digestion into the cell. Cinnamon also has some indications for supporting blood sugar management. And then vinegar, there was some good studies looking at vinegar. I think if anything on here that might be fairly okay to take is considering like apple cider vinegar, but just be careful that you don't, mess up your esophageal lining because of the acidity. But there's studies showing that over 12 weeks, there was a 1.9 kilogram weight loss with, vinegar, like apple cider vinegar. And it also has been shown to support insulin sensitivity, so you can consider that. And then there was some information on 5-HT supplementation, which helps suppress serotonin, may help reduce cravings of carbohydrates. But again, you got to be really careful with medications, as there has been some interactions with antidepressants, antipsychotics, or other medications. All right, and again, don't forget to check with your doctor. No matter what I say here, you always want to make sure that you check with your doctor before making any drastic changes in your diet. So in summary, diabetes is serious. We want to take it as seriously as possible, do everything we can to manage it over time. Weight management is a powerful intervention for diabetes. It can help to reduce the risk for diabetes. We want to eat a well-balanced meal with plenty of protein, non-starchy vegetables. Keep junk foods out of sight, out of mind. Don't go grocery shopping while hungry. Reduce your portion sizes. Aim for a calorie restriction of around 500 calories per day if you're looking for weight loss. increase by 500 calories if you're looking for weight gain. Keep a record of your food intake and your physical activity, and also try to induce exercises where you're burning like 200 to 300 calories at a session, and then use supplements with caution. All right, we got like 5 minutes. We can open the chat up. Don't forget also, before we conclude, to get that meal guide, which I'll show you what it looks like quickly while you all ask some questions.
James, I have a question. This is just from what I've recognized, and I don't know how the statistics are. Is there any link between, genetics and diabetes, or any link between, this is what I think that I see, that, diabetes type 1, type 2, or even the third is it more prevalent in the African-American community, or, the Latinx community, or the Hispanic community? Am I seeing that right? Or is there any connection that you know of during your studies?
Yeah, certainly there's some indications that diabetes certainly can affect those that are in lower socioeconomic settings, or, for those who have, followed a specific type of lifestyle. Generally speaking, with type 1 diabetes, it's going to be more genetically related, but type 2 is more socioeconomic. So based upon, say, your choice of food, what you're accustomed to, your physical activity, that could all influence your type 2 diabetes. And yes, there are statistics showing that in those minority settings, there is a higher percentage of diabetes, without a doubt, but that doesn't mean that we have to stay accustomed to that notion. It can certainly be controlled, particularly type 2 diabetes, by changing your food regimen, your exercise regimen, little by little, to knock down that risk for diabetes. But in general, just looking at the United States society, it's the way that we're set up. We have more technology that causes us to reduce our physical activity. We have foods that are more processed, which is going to essentially affect all individuals, despite, what your race may be, or even socioeconomic status. But unfortunately, just like, with COVID-19, it's been affecting more, minority individuals because of the predisposed conditions like hypertension, obesity, COPD, where there's more of a risk factor. So that's why we need to act now, and we got to take, diet seriously and exercise.
Awesome. Thank you for sharing that. Just on a logistical matter, I do want everybody to be aware that James Lucas will be continuing his health and wellness series on May 30th. We are going to skip a week so we won't be on next Saturday, but he will be back on May 30th, same time, 10 a.m. Saturday, for part 4 of health and wellness, and it's called What's Cooking in My Kitchen. And he has a special treat for everybody, and we're looking forward to having everybody there. I'll obviously send everybody back the information on that as well.
Definitely. I just included in the link, I'm going to answer this question quickly, but if you want to check out this meal guide, I'm telling you, this is powerful. I mean, if you don't know what protein foods are, I've looked up every single possible protein food that I could think of. This here shows you chicken, fish, eggs, everything. Fats. You want to know fats? It's all right there. All you got to do is download it and post it up on your fridge. All right.
James, we had a question from Erica. It says, can you help construct a meal plan with unique dietary conditions? I am on a autoimmune elimination diet and have additional food allergies.
Generally speaking, I can probably provide you with some guidelines and principles that might be fitting, but it may be worthwhile to go to a specialist, a particular dietitian that specializes in those particular conditions, like food allergies. And I can help you find those individuals, like by going to specific resources like eatright.org, where there are dietitians that really specialize in that particular setting. But I can give you general principles that can set you off on the right foot. But I highly recommend a specialist in those areas.
And there was another question that said, do you have type 1 diabetic meal plans for weight loss?
Well, that one, I don't have meal plans. That will be more of an individualized discussion because each person's going to be different again. just say calculating your nutritional needs at baseline. We need to know what is your carbohydrate need in order to keep yourself out of hypoglycemia. So that would be more of a, one-on-one discussion, and I could certainly provide some direction, guidance in that regard, and look at what you're doing now, what challenges you have in order to put you into a greater state of health and blood sugar management.
Awesome. Well, thank you to everybody. I just have a couple things I got to get out real quick. If you do need some individual services and you want to chat with James individually, I suggest that you go to www.jlucasnutrition.com, and you can find meal plans. You can consult with him on a one-on-one basis to get your individual needs met. The link, I saw Nithya just posted the website in the chat, and I can also you can find that. Contact me if you're in a rush, and I'll set you up with James. Also, you can go to James's YouTube, J Lucas Nutrition, and just follow him and stay connected with him, and he'll get you set up the way you need to get set up. So James, we just wanted to say thank you for that. I also need you all to fill out the survey, and I'll send it to your emails as well. Tell us how we can better serve you, what you liked, what maybe you think we can, some areas of improvement moving forward. And we will be back next, the week after next on May 30th for What's Cooking in the Kitchen. James got some special treats for us. And also I just want to say this Monday, for the folks that are living in Meriden, I know we're getting back to open up the state, and especially in Connecticut, and things are opening back up. So the Director of Health and Human Services is hosting a open forum, question and answer. I would suggest that you join. I'll put the link in the emails. It's a Zoom link from 1 to 2. Just join. It'll be just a fireside chat on what we can do to prepare ourselves for this as Connecticut begins to open up. And then at 6 p.m., we'll have our Table Talk series continue with Equity CT. And that's Erica Haynes, who's in the chat right now. And this is on what exactly is Equity CT. And I'll send out the links to everybody on this. So I'll send out everything that's coming up for next week. But I want to thank everybody for joining us today. Thank you, James, for once again a wonderful series. These meetings and these series, Health and Wellness, have been recorded, so we can send them out to you. They're also available on James's Instagram, on his YouTube, and on all his platforms. But I can get these to you as well, so you can kind of double back and study through it. So we want to thank everybody for joining us. Check your emails, fill out that survey monkey, and then we'll see you very soon.
Thank you. Enjoy your weekend.
Thanks, everybody. I'll see you soon.